Earlier when you were speaking, you spoke about andropause and you made mention of menopause. As for menopause, we have heard it and heard it and heard it, but what is andropause?
Well, andropause, men go through a similar condition as a menopause, which is called andropause, and where the hormone levels fluctuate. So the female system is ran off of predominantly estrogen, and they do also have testosterone, but it's at a lower rate. For males, it tends to be our testosterone drops down very low. Our bodies are ran off of testosterone as the male hormone, but during andropause, our levels start to decline, and sometimes the estrogen levels start to increase. So it comes with a whole list of symptoms such as erectile dysfunction, low energy, low metabolism, memory issues, also weight gain. There's a lot of different issues that come with that.
But at what age does it set in?
Each individual is different, but usually the average age is around 40 to start looking for signs of low testosterone.
40 years?
Yes, 40 years.
Wow. And then menopause starts when?
Around the same time.
Around the same time? 40 years a woman could have menopause at 40?
Yes, she can.
Wow. I thought it was around, let's say, 60 years there.
That's 40 is when I say menopause, there's symptoms where you start to fit into the category where with menopause, your hormone levels start to how should I put it? You emit less hormones. So a woman starts from 40 years going. Once she can reach full menopause at a different level, so maybe 50, she can reach full menopausal state where she's no longer having menstrual cycles. Her hormones are no longer active. But that's treatable now.
It's treatable?
The symptoms are treatable, I should say.
Okay. All right, now let's go back to the men issue because you just kicked me a little bit there. I thought it was going to be around like the 60s and all, but 40, we all need to look out. So if someone is forgetful, there's a bit of memory issues, he puts the pen here, he can't, remember this is why I left the pen, Are those signs to look out for?
They can.
Or they are natural, it happens.
They can be, but we all have, I think even me, myself, a lot of people, we have issues remembering. But the thing is, there's such thing as short-term memory loss. There's a lot more advanced forms of that, where, everything is like you forget everything, but it's normal for us to forget at times. Where do we put our keys? That's a common one.
Yeah.
Where do we put our keys at? Or, did I turn the light off? I can't remember.
Yeah.
But so that's normal. But there's certain things that you'll start to realize, hey, it's starting to get worse. And it's not always that it's hormones that are causing that, but it's one of the symptoms.
Because I had to ask, because sometimes I'm a bit forgetful. I'm like, hey, am I getting andropause now? And so I had to ask. But let's talk about, the treatment you mentioned for the symptoms. Now, how does that happen?
Well, for those who are suffering from, I would say, chronic issues, which that would be there's a range of where your hormones are. That's why I say it starts at 40 to decline. But it ranges. So we don't treat it until it gets to a chronic state. So once it gets to a chronic state, then we can do hormonal replacement therapy, which we can boost the hormone levels up. But first there has to be a comprehensive assessment done to make sure what exactly is causing the decline in hormone production.
Now to the all-important issue about what should trigger somebody to come to you for these examinations. At what point do I decide that, no, I need to go see Tyrone and the team?
Well, first of all, they won't be seeing me.
They'll
be seeing
the team.
Yeah, they'll be seeing the team, yeah. But some of the symptoms, or some of the things that that you may have to look out for if you are replacing for your natural performance, such as men's sexual performance.
Okay.
If you have to take a pill or you have to pop pills every time, to perform, then maybe, you want to look at the root cause of what's causing that rather than taking the medication to always perform in the bedroom. Another thing would be very low energy. If you notice that you struggle to get out of bed every morning, it's just a struggle. All of a sudden you're putting on weight out of nowhere. These are all signs that you should come and get yourself checked out.
Now, I know people would ask the question, is it expensive, coming for, all these processes and procedures and consultations and all? Is it expensive?
No, even though our office is located in East Legon, so it scares people sometimes. Yeah. But our prices are very affordable, to be honest. Just for a screening, for a consultation is only 200 CDs or something, okay. 250 CDs, I may believe. Okay. But it's pretty affordable.
Okay, all right. Now, I just had somebody send me a question that are there natural ways, to avoid this whole aging thing? Are there?
Yes, you can't always be certain, but there are ways to kind of push it away, which are what we talked about earlier, the extra staying active. That plays a huge role into your hormone production. Sleep is a major one. People who don't get enough sleep, at least 6 hours of sleep a day, that's a huge, also another hit onto your hormone system. Drinking water, taking the necessary nutrients. A lot of us don't eat our vegetables, so if you're not eating vegetables or fruits, then you need to be taking some type of vitamin supplement. So just a healthy lifestyle in general can help us prevent some of these things from happening.
All right, quickly, a texter just sent me one, and he says, Sami, I'm enjoying the conversation with your guest. He mentioned East Legon. Can you ask him to tell us where specifically, and if there is a number would have to use to contact them? I'd be grateful. So people want to know about where you are, and if there's email, website, or social media presence, anything like that.
Yes, we have, the location is actually 64 Garden Street, and that's in East Legon, opposite Agape House, just about 500 kilometers from ANC Mall, in between Malcolm and ANC Mall.
Okay.
We have a website, www.americanrejuvenationclinic.com. You can type it in Google. We have several numbers listed on Google. You can even access the Google Maps. It'll take you right to the location.
All right, but how about social media presence?
Yes, we have Instagram, American Rejuvenation Clinic on Instagram, Facebook, also LinkedIn.
All right, so in ending our conversation, what would be your final words to anybody who is listening or viewing us this morning?
I would just say to everybody to please, let's take our healthcare serious, and especially with this, you see the prostate and COVID. Prostate cancer is taking a lot of people out early. COVID going on right now, so let's take our healthcare serious and screen ourselves properly. Don't wait until 3-4 years after you're feeling symptoms, something's hurting you, or you feel weak. Come and just get some laboratory work done. Check yourself out thoroughly every year, especially after 40.
I'm grateful you made time to join me this morning, Tyrone.
Thank you. I appreciate it.